Hey guys, Dr. Luke String from Advanced Health Chiropractic, and I just want to answer a really common question that we see and get all the time in our office, and essentially it's, why does my lower back pain refer? Why is my lower back pain starting to essentially get numb and tingling into my glutes or into my legs? Well, in Advanced Health we focus on three main aspects when we're addressing lower back pain specifically and the spine. You have to look for good alignment within the spine, you have to look for good joint function and good tissue health, but you also have to address the integrity of the disc, and that's what we do really well here at Advanced Health. So let's go over essentially what we expect to see within a healthy disc. So what you see here is essentially an intervertebral disc, this right here. So what makes up a disc? You have a lower vertebrae, an upper vertebrae, and a disc. And these discs essentially are designed to absorb force, like shock absorbers within the spine. So when you evaluate a healthy disc, it should kind of look like a jelly donut. So this round here is collagenous material, and that's kind of like the bread of the donut. And then this in the middle here, the fluid is that, essentially that disc fluid where the nucleus sits, and that's kind of the jelly within the donut. So what happens is when you have a healthy joint, i.e. a joint that is loaded in the posterior, and a joint that moves really cleanly, and a soft tissue isn't under stress and tension, so it's not compensating, you can essentially load that disc appropriately. Okay, so essentially what happens is through traumas, can be big traumas, lifting injuries, car accidents, but what we see a lot of in our offices, repetitive stresses through things such as sitting, is we start to shift alignment within the spine, which then effectively starts compounding and compressing the disc. So if we're going to talk about alignment within the spine, when you evaluate the lumbar spine, you should see this lordotic curve, essentially this curve right here. It should be at 40 degrees. And when you've got a good curve within the spine, the back of these joints, all this extra bone is, hence why we have that extra bone there, is loaded. It absorbs the majority of the force with obviously some help from all these discs here. However, what we see essentially in the office a lot of is sitting, because sitting is the new smoking. The average American has to sit for over 14 hours a day. What happens is the spine starts to shift out of alignment. When it shifts out of alignment, it creates all sorts of compensation issues, but the biggest one is our weight transferred forward. And when our weight transfers forward, you start loading the anterior, the front of these discs here. That creates a lot of interdiscal pressure. And obviously when a disc is under pressure over time, it starts to break down. So how does it break down? So what happens is over time, that pressure, you start to see this disc thinning, and the disc starts to bulge out. When it starts to bulge out, it starts to shift in towards this nerve canal, okay? Now, phase 1 degeneration, disc thinning, usually you're just going to get pain, not necessarily essentially referral pain. However, if you don't address this through specific treatment, such as traction, decompression therapy, then over time this disc is going to degenerate. So when you see a degenerative disc through essentially lots of abnormal weight bearing and poor weight bearing over an amount of time, what happens is the disc becomes damaged. So what happens is the collagenous material around the outside starts to break down, and it can't hold the jelly of the donut, the disc fluid, within essentially the nucleus anymore. And all the stress and tension that we're bringing through here will create a weak spot, and a weak spot usually comes towards the outside, or essentially the posterior, the back of the disc here, or laterally. And what happens is that disc fluid starts to shift, and when it shifts into what we call this intervertebral foramen, this nerve canal. So obviously when the disc fluid starts shifting in to the nerve canal, you start impinging that nerve is going to give you pain where the nerve originates in your lower back, or where that nerve goes to. And all the lumbar plexus, all the nerves within your lower back, obviously innervate your lower back, but also innervate your extremities. So essentially, why is your disc pain, or why is your pain referring? Well, there's a good chance that your spine is shifted out of alignment, and we're starting to see degeneration of the spine. Now, it's critically important to essentially, one, diagnose, and two, correct. Twofold. One, if we miss the diagnosis, for example, we go to see our medical doctor and we get some muscle relaxants, but what happens is the tissue around the joint is designed to shut the joint down and stop it moving, to protect it, becomes loose, and essentially allows the joint to move. Unfortunately, that's just going to exacerbate and make the problem worse over time. The second reason we need to get it corrected is because, unfortunately, we can't replace our spine, and we can't really replace those discs. So once you start seeing degeneration, it's things that we can't get back. So effective treatment will consist of essentially chiropractic adjustments, which we obviously do here, but essentially it's going to adjust the structure of your spine. We're going to do some traction or some decompression therapy. I'm going to show you those, how we do it in the office, a little later on in some other videos. So if you're suffering from lower back pain, your pain's starting to refer into your legs, you have a family member, a co-worker, a friend that's suffering from the same issue, I strongly encourage you to get it checked out sooner rather than later. Super easy to do. Hit the button at the bottom of this video, fill out the contact form. We'll be in touch really shortly, and we look forward to giving you some specific answers and essentially get you on the road to getting this low back pain corrected.